Guys, welcome to my YouTube channel Ayurveda Basking. So today we are going to discuss most important MCQ of Rog Nidana paper 2. Along with that we will deal some concepts also. In the previous video you have already seen some important things I have already mentioned, and now you can see in this MCQ also those things will be repeated. So let's start our discussion, and the first question is: significant bacteriuria happen when the amount of bacteria in urine is 105 CFU per ml is the right answer, which is not an Upadrava of Raktapita, and this is the shloka for Raktapita reference from the Rog Nidana sthana. So they are Adorabalyam, Arochakam, Avipakam, Swasam, Kasam, Javra, Atisar, Sof, Shoshor, Pandu, and Kamla is not coming in that. Right answer will be the D option. Fever in which heart rate is not raised in proportion to the temperature is called slow pulse fever, and is also known as the fidget sign, that is typically signs in the infectious disease kind of typhoid and the dengue fever. Generally what happens when temperature will rise, then heart should have to rise, but this is a special kind of fever in which this trend is not follow. Which among the following is not included in the Saptadravya of the Kushta? So Saptadravya is having basically 3 dosha, along with that 4 dhatu: rasa, rakta, lasika and mamsa, in which ojas is not included. So right answer will be the option C. Hrilasha is a feature seen in which type of Hridroga? So Hrilas is seen in the Crimija type of Hridroga, and we already discussed there are 5 type of Hridroga: Vata, Pitta, Kapha, Sannipata and Crimija. And one simile is also given regarding the pain, that is a Karkash Neva Daryate in the Crimija Roga. Ha ha iti pri devite is a feature scene, that is a scene in the Adija kind of Unmada. In Ashmari, Go Medaka Upamam is a feature of. So in Ashmari, Go Medaka is a feature that is given as a Samanya Lakshana for the Ashmari. And in Patika, in books there is mentioned Ballatka Asti is a simile which is resembling the color of the Ashmari that is formed in the Pittaja type of Ashmari. Guma is seen in which type of stages? So here I have enumerated some stages of syphilis. First stage is known as a painless sore, that is known as chansre, and second is having the rashes, flu. Other symptoms are also there, and the third is typically the fatal stage in which organ damage started. And this gamma is basically the ulcerative granular loma on the skin, and it is happening in the tertiary stages. Structural deformity result in which type of Mutraghata? So in Mutra Sangha, the Sangha of the Mutra is happen due to the obstruction, so that we can relate with the structural deformities. Type of Shula, according to Madhav Nidana, there are 8 type of Shula. We have already discussed that things in our previous video. Then Karachara Daha is a feature of. So burning sensation in the feet and hand is a feature of Urdhvaga Raktapitta. In Urdhvaga Raktapitta there is also different kind of vomiting are mentioned, and basically color of vomiting is also typical feature of this Urdhvaga Raktapitta. Then Dagda Guda Bhasam is the seen in which type of Atisara? So Dagda Guda Bhasam is the stool feature that is seen in typically the Vatika Atisara. Brish Dushchikitsa is one among the following. So Brish Dushchikitsa is the Vilambika, and sometimes it is also told that Visuchika and Alaska, both of this feature are seen in the Vilambika. Dosha predominance of Abhighataja. So Abhighataja Javra is coming under the Agantu Javra, in which there are 4 type are there: Abhighataja, Abhisanga, Abhichara and Abhishapa. In Abhighataja what is happening? Basically the injury is happening. So Acharya is saying there is predominant of Vayu, and along with the Dushta Rakta. This is the vitiated doshas here, Vata and the Dushta Rakta. And then Abhisanga. Abhisanga is mainly have the Vata and Pitta, and Abhichar and Abhishap have Tridoshaja vitiation. Which among the following Swasa is a Svam Samshamnam? So Svam Samnam Swasha is a Shudra Swasha which can pacify by itself. Blood stained sputum is seen which type of Kasa? So Shataja Kasha is a shloka is like Kafam Tena Shonitam. So blood stained is seen in particularly the Shataja Kasha. In Shayaja it is a Lohitam Haritam. So a reddish with greenish color is also there. Then number of type of Masurika according to Madhava Nidana. So Madhava Acharya mentioned 5 type of Masurika, which are Vata, Pitta, Kapha, along with the Rakta and Sannipata. Instead of that, he's also mentioned 7 type of Dhatuka, like Rasa, Rakta, Mamsa, Medas, individual Dhatu. Then dosha predominance of Shita Pitta. So Shita Pitta is basically Vata Adhika, and another same thing having similar kind of presentation, Udara is having a Kapha predominance. This is like one of the repeated question, many time and repeated. So you just remember this point. Then Vali Nasha is a seen in a which stage of Udara? You know Udara having a 3 main stages, that is Ajataka Udara, Picchavastha and Jala Udara. But this term specifically mentioned Raji Janma Vali Nasho is for the Pura Rupa of the Udara. Tila Pishta Nibam Purisha is seen. Tila Pishta Nibam basically the whitish thesis or Svet Varcham that is typically seen in the Shakha Ashrit Kamala or Ruddha Patham Kamala, in which yellowish discoloration on the body is there, but the feces of the person is the white color. And we can relate it with the obstructive jaundice like condition. Dosha predominance in Amajena. So Amajena basically the Kapha predominant dosha. Bhukte Jiryati Yat Shulam is a symptom of, so it is a symptom of Pranama Shula. In previous video I have already explained you this guy, this Annadravya and the Pranama Shula both. Amaja Atisara is a type of Atisara that is mentioned by the Sushruta Samhita. Sa Purvam Kaste Sushkam Tatam Stivet Shonitam. Again it is a Shataja Kasa, we have already discussed, like blood stain sputum is coming in the Shataja Kasa. Red hepatization is a condition in which condition. So basically it is found in the pneumonia, and there are 4 mainly stages. First is the congestion, second is your congestion, second is red hepatization, third is the gray hepatization, and fourth is the resolution. Next question is hematuria is a predominant sign of, so hematuria is a predominant sign of nephritic syndrome diseases. And in this nephrotic syndrome, edema is there as a predominant symptom, and specifically the edema around the eye. Then acute kidney is having a predominant symptom of oliguria, blood output will be less, and chronic kidney disease not have that much any particular symptom, but is one of the silent killer disease. Which dhatu is the ashraya of the Tritaka Javra of Charak Samhita? So this is a very important concept, and you can guess one MCQ from this part, because Vishama Javra, this is somewhat confusing part, and some Acharya have variation in this point. So according to Charka, if we talk about Santata, Satata, Anya Dushakam, Trityakam, Chaturtakam are the 5 type of Vishama Javra, and according to Charka, Santata have Rasa predominant, then Satata is Rakta, Anya Dushakam is Medo, Trityam is Asthi, and Chaturthakam is Majja. But according to Sushruta, Santatam is basically Rasa and Rakta, first 2 dhatus, and Anya is next, and Tritya is next, Medu, like this. So here he is asking about according to Acharya Charka. So Charka accordingly, Tritya is basically the Asti dhatu involvement. Right answer will be the option D. But according to Sushruta, it may be right answer maybe goes to the Medu. Next question is spoon-shaped nail is observed in. So spoon-shaped nails is a characteristic feature of the nail abnormality that is seen in the chronic iron deficiency, and along with that in vitamin C deficiency there is a corkscrew hairs, that is a brittle hairs and dry hairs found. Which among the following is not an Upadrava of Rakta Pitta? I have already mentioned that shloka, and that Shosha is there, Javra is there, Kasa, Swasa is there, but no Gulma is mentioned. So right answer will be the D. Dosha predominance in Vilambika. So Vilambika is basically Kapha and Vata predominant. So right answer will be the option C. Sankhya Samprapti of Galaganda is 3. We have already discussed this question. Which among the following is not included in the 3 Rupa of Rajayakshma? This 3 Rupa, Shad Rupa and Ekadash Rupa I have already mentioned in that video, and that out of this 3 Rupa, Pratishaya is not mentioned. So right answer will be the B option. Muhur Vigratidam Upaveshtam is a symptom of which Atisara? So it is a symptom of Pataja Atisara. Agantu is not a type of apasmara. Only 4 type of apasmara is there: Vata, Pitta, Kapha and Sannipata. Next question is Bina Vibhastam Chestam is a feature of which type of? It is a type of a Murcha. Vipulakshata is a lakshan which is seen in the Swasa Vyadi and specifically in the Chinna Swasa. Dosha predominance of Adhoga Amla Pitta is when Amla Pitta is a Adhoga direction, then it is having a Pitta predominance. Dosha predominance of Sheath Pitta is Vatika. Again, this question is repeated, so it is a very important question. Vidal test is done for the diagnosis of which disease? Typhoid. We are doing the Vidal test. Unconjugated bilirubinemia is seen in the hemolytic anemia. So right answer will be the D answer. And next question is dosha predominance of Vidagdha Ajirna. So Vidagdha Ajirna having basically the Pitta predominance. So right answer will be the B option. Jeerne Jeeryati Ajirnam is a symptom of Annadravya Shulam. The previous question we have done, that is for the Pranama Shula. This is Annadravya. So you just study this two quotation of Pranama Shula as well as Annadravya. Chances are high from this portion also. Vidagdam Shuktatvam Ati Bhuktam Amashit Sitam is a samprapti of Alasakam. Then Durgandhi Haritam Raktam Puyo Mishritam Kafam is a Shayajakasha. In previous question we have studied like that blood stain sputum is mainly the Shatajakasa. But here what is happening? Along with Rakta it is a Puti. Foul smelling is coming and greenish color is there. Durgandha is there. That is basically the Shayajakasha. Grey hepatization we already, this is a pneumonia. Proteinuria is a predominant symptom of chronic kidney diseases. Right answer will be the option D. Which dhatu is the ashra of Satata Javra? Already I have explained. This is the right answer will be the Rakta. Pernicious anemia is a cause due to the deficiency of vitamin B12. Next question is Pidite Unnumati is a feature of which type of Sosha? So Pidite Unnumati is a type of the Vatika Sosha, means non-pitting edema, and pitting edema kind is found in the Kaphaja type of Sosha. Food that does not come either from downward or upward direction is known as, in the condition when food is not going upward or downward and it is a stagnating situation, that is known as a Alasaka. When you see the definition of Alaska, you can get the exact meaning of this line. Then dosha predominance of Pundrika Kushta. This is like from this Kushta, it is a very important 18 type of Kushta and the dosha predominance. And you can see in our last video also. Here I have also written in Vata Kapha basically Charma Kushta, Eka Kushta, Kitibam, Siddhamam, Alaskam and Vivadika are there. And in Kapha Vata Dadru, Shatarushi, Pundrikam, the Spota, Palm and Charmadal is there. So here question is regarding the Pundrikam. Right answer will be the Kapha Vata or Vata Kapha. Anubandha is a feature of Kota, and specifically in Kota sloka Anubandha is mentioned, so right answer will be the Kota. Next question is conjugated hyperbilirubinemia is seen in all except, so it is seen all this condition except hemolytic jaundice. Then Vibhrantam Lochanam is a Lakshana which type of Swasa Vyadhi. So Vibhrantam Lakshana is found basically the Mahan Swasha, and Vibhrantam Aksha is found in the Urdhva. So it is a very minute difference, but you have to remember Vibhrantam Nayanam or Vibhrantam Lochanam is seen in the Mahan Swasa, and Vibhrantam Aksha is seen in the Urdhva. Rakta Lochanam is seen in the Chinna Swasa. So this is the specific about the Lochana is mentioned in the Swasa. Which among the following is not included in the Shadrupa? Again, Rakta Pitta is not included, and we have already discussed this 3 Rupa, Shadrupa and Ekadash Rupa of Rajayakshma. Which among the following is caused by the nematode? The right answer is the filariasis, which is a screening test for the syphilis, and the right answer is VDRL test. And the next question is type of Chardi. Again, we have already discussed this question basis on the Bheda, that is the 5 type of Chardi are mentioned: Vata, Pitta, Kapha, Sanipata, and along with the Dvishtam. Which type of Pranama Shula is subsided by the Katu Tiktarasa? So out of this, Kapha is the right answer, but specifically I have also mentioned for pacification of Vataja kind of Pranama Shulam, Snigdha and Ushna is mentioned. For Pitta pacification, Katu, Amla, Lavana and Shito Upchara is mentioned. Shokaja and Amaja are the type of Atisara. So like this is also repeating many times. Muhur Baddha, Muhur Dravya is seen in the only one Vyadhi, that is the Grihani, and it is actually Grihani's Pratyatma Lakshana. Shyav Netrata is a Lakshana which type of Hridroga? It is found in the Krimija Hridroga. Then Ashmari Tulyam Granthi is found at its, it's also like direct question from the shloka. Mutra Granthi is mentioned, Ashmari Tulyam. How many type of Mutraghata is there? There are 20 type of Mutraghata. Bhasmo Udakam Prati Lakshana is a seen in the Mutra Shukra. when Shukra is mixed with the Mutra. Which of the following is not the Samanya Lakshana of Javra? So it's having a Sveda Vrodham, Santapa is there, Sarvanga Grahanam is there, but Vachitram is not the Lakshana. So right answer will be the option D. Dosha Pradhana of Hikka is the Vata and Kapha, which is not a type of Hikka. So Hikka is Annaja, Vyapadam, Shudram. This all are type, but Tridoshaja is not mentioned in this Hikka. Basically, in Swasa and Hikka, there is no doshaja relation is mentioned like of Kasa. Which of the following is the Asadhya Visarpa? So out of this Sannipata is the Asadhyam. Pittaja Parmaya, there are 6 type of Pittaja, and if we talk about Kapha, there are 10, and Pitta there are 6, Vata there are 4, so total there are 20 type of Prameha. Siddhma is a Vata Kapha kind of Kushta. Incubation period of measles is 10 to 14 days. Type of Amla Pitta is 2 type of Amla Pitta are there, Urdhvaga and Adhoga, based on the movement. Then Masurika are considered as Sadhya. If Masurika in Tvak and Raktagat, then it's considered as Sadhya. Shita Pitta is a dosha predominance of. Shita means Shita Guna means Vata, and Pitta means Pitta. So Pitta and Vata. According to Madhava Nidana, there are 8 type of Shula. So here we are ending our MCQ session. Thank you guys.